wash my hands. So, hi, I'm Abby. I'm a PA student at Kansas University. Can I get your full name and date of birth?
Sure, I can.
No, your full name.
10-4-84. No, I'm being you.
Oh, okay. Miss Kent, is it okay if I call you Abby?
Yes.
Okay.
I wouldn't do that.
Don't say that. Just wait. Let her
Well,
say
you
that.
always call them by Miss and their
Kent.
last name.
Okay.
Never call a patient by their first name unless it's their idea.
Okay. So, Miss Kent, I'm going to be doing your full head-to-toe exam. I'm going to start by draping the patient. Go ahead and put your arms through here. I'm starting my general exam looking for any obvious signs of distress or the state of health.
You said you were here to do her exam?
Mm-hmm. For her head to toe.
For her head to toe. Okay.
I'm looking for any her state of health, obvious signs of distress. I'm noting grooming, proper hygiene, any abnormal odors, any mouth odors. I'm going to start by taking your vital signs, making sure that she's been sitting for 5 minutes before doing my blood pressure. I'm going to estimate her blood pressure first, and with this, I place the cuff on, I pump it up, and when I first feel her pulse, I add 30 millimeters of mercury, and that's what I pump up when I also take. So at 108, so I'm going to add 30 millimeters of mercury and all the cuff off and let it sit for a minute. Blood pressure was 108 over 66, and you let it go for an extra 10 to 20 millimeters of mercury. I'm just going to take a pulse, go ahead and relax. Her pulse is 62 and respirations of 18. And then lastly, Ms. Kent, I'm going to take your temperature. This goes underneath your tongue.
Okay, yeah, go ahead.
Okay, so the temperature was 98.6, which is normal. Okay, so now I'm starting my general exam, looking at the skin, noticing the face, the lips, also the trunk and all 4 extremities. I'm gonna palpate, I'm gonna start touching you, and palpating, feeling for temperature, noting any, noting the distribution of hair and the texture, looking for any edema, nevi, scars, or lesions. Now that I'm at the hands, I'm looking for any clubbing or pitting edema. I'm going to test for capillary refill, which should be from 2 to 3 seconds, doing that bilaterally. And now I'm going to do the lower extremity. Do you mind if I take your shoes off? And doing the same, her nails are painted, but also with the feet, looking for any edema, feeling for the temperature, the hair distribution all the way down, noting nevi, scars, or lesions, looking for any pitting, clubbing of the toenails, and capillary refill. Now that the skin exam is complete, I'm going to move on to the face. Do you mind taking your hair down? When I start, I'm going to start with her scalp, so I'm parting the hair. I'm looking for any signs of trauma, any nevis, any parasites, moles, rashes. Okay. And now, doing a general exam of the face, looking for any asymmetry. Again, I would look at the lips, making sure that there's no cyanosis. I'm going to palpate you now. I'm feeling the frontal sinus. Do you have any tenderness here? No. In the maxillary sinus, what about here? Okay, and I'm also going to palpate the TMJ. Can you open and close your mouth? Open, yep. And I'm feeling for crepitus, and can you move it side to side? And now can you clench your teeth? Good, and that's cranial nerve 5. So I'm going to continue with cranial nerve 5. I'm going to do a sharp and dull sensation on the 3 divisions of the 5th cranial nerve. So this is dull, and this is sharp. I'm going to have you close your eyes and tell me what you feel.
Can I tell you something?
Yeah.
So dull and sharp, you just want to touch.
Oh, not roll.
Right.
Touch, dull, sharp. Okay.
Sharp. Dull. Dull. Sharp. Sharp.
Good. And now I'm going to continue with light touch. So this is the light touch with the cotton swab. So just go ahead and point where you feel me touch it. Good. I'm going to move on to cranial nerve 7. So can you close your eyes and don't let me open them? Good. And can you puff out your cheeks? Smile and show me your teeth. Good. And now moving on to the eyes. I'm noting the periorbital region of the eyes. I'm looking at the sclera, making sure it's white. Looking at the conjunctiva, it should be a light pink. Good, and I could flip the eyelid to look at the top. I'm going to start with my my visual acuity, which is cranial nerve 2. Miss Kent, do you wear any glasses or contacts? Mm-hmm. If she did, I would do it both with and without. So I'm going to have you cover your right eye, and I'd hold this. This chart is 14 inches, so hold this 14 inches or have a string tied to it that's 14 inches away. And go ahead and hold this and read the lowest line possible.
683,279.
Good. Which is 20 out over 25. And can you do the other eye now?
372,646.
Good. And then both together.
372,646.
Okay. And now I'm going to move on to extraocular eye movements. So this is cranial nerves 3, 4, and 6. So what I'm going to have you do is stare at the tip of my pen, or as I go through this, and with this I'm looking for any nystagmus, stopping in each position. Good. And now I'm going to check for accommodation. So what I'm going to have you do is look at the tip of my pen and the wall behind me, and the tip of my pen and the wall, and tip. And now I'm going to check for convergence. So follow the tip of the pen. Good. And I would dim the lights. I'm going to check that pupils are equal, round, and reactive to light. And with this, I'm looking for both direct and indirect reaction. So first I'm looking that this pupil is directly reactive to light, and now I'm going to look for indirect in this pupil. And now I'm going to finish the eye exam with my my fundoscope exam. So I'm coming in at a 15-degree angle. So go ahead with this, just stare right in front of me. And I'm looking for the red reflex of the retina, the vessels, following it to the optic disc, looking for the optic disc cut to disc ratio, also for any hemorrhages, drusen bodies.
Okay, you can go ahead.
Okay. So now I'm going to begin my ear exam. I'm going to do a general whisper test with you. This is for cranial nerve 8. Please tell me what I say.
Baseball. 1, 2, 3.
Good. And now I'm going to do my ear exam. So